Time Up and Go test presented by Anjali Varotaria, Jinal Vadi. Guided by Dr. Hina Dangar. Time Up and Go test or Get Up and Go test. TUG test uses for as a quick measure of dynamic balance and mobility. TUG has been used to examine functional mobility deficits in patients with stroke and Parkinson's disease. Merits: simple to perform, less equipment, quick measure of dynamic and functional mobility, correlates to balance and fall risk. It is gait speed test used to assess a person's mobility and requires both static and dynamic balance. Equipments: stopwatch, standard chair, and measure tape. How to perform TUG test. The patient is seated comfortably in a firm chair with arms and back resting against the chair. The subject is allowed to use the armrest during the sit to stand and stand to sit movements. The patient is then instructed to rise and walk as quickly and safely as possible 3 meters, cross a line marked on floor, turn around, walk back and sit down. The patient is allowed to wear regular footwear. The patient is allowed to use an assistive device typically used but must complete the test without manual assistance. Time to administer is less than 5 minutes. Therapist instructions: start timing on the word go and stop timing when the subject is seated again correctly in the chair with their backs resting on the back of the chair. Wears regular footwear, may use any gait aid that they normally use during ambulation. No assistance by another person. There is no time limit. They may stop and rest if they need to, but not to sit down. When I say go, you have to stand up and start walking as quickly as possible to a line, turn around the cone, walk back to the chair, and sit down. Okay? Go. Interpretation: less than 10 seconds, healthy individual; 10 to 20 seconds, frail, elderly, or individuals with mild disability; greater than 30 seconds, impaired mobility and high fall risk.